Welcome, everybody. All right, good evening. Can everyone hear me and see me okay? Always want to check. Make sure that we are good to go. Everyone good? Okay, let me. All right, very good. Thank you so much. So good to be with you again. Um, we're going to Okay, thank you. We're going to wait. I'm going to say my disclaimer just while we wait for anyone who wants to join to jump on. I'm going to be sharing a lot of health information with you tonight. This is not to be considered health advice. Do not start taking or stop taking or change the way you're taking any of your medications. If you feel like you need to do so, please first consult with your prescribing practitioner so they can help you make those adjustments appropriately. And attending this Wellness Wednesday does not establish a doctor-patient relationship. And first of all, before I get into it, I want to, I'm super excited for our upcoming masterclass. So the dates for that, the 31st of this month through September 2nd. So Monday, Tuesday, Wednesday, 3-day Fix Your Thyroid Masterclass. Each of those evenings, and we'll run for 90 minutes. Look, I just got done doing a boot camp, a 1-day boot camp, 90 minutes. I think it went very well. I was able to pack a ton of information into that 90 minutes. And we got several people commenting that, a lot of comments that, man, there's too much here. There's too much information. So, you know, I guess for some people it's great. And for some people, you just, they said, I'm going to wait for the masterclass. So we're going to do the masterclass again. It's time to do that. And 3 days of the information you need really to explain why you still have the symptoms you have, even though your labs are normal, even though you're taking thyroid medication, even though you don't have a thyroid gland. Why in the world are you still feeling like garbage? And why it's not all in your head. I'm going to show you so much to explain why you have the symptoms you have, and it may not be your thyroid. That's one little nugget that I'll share with you. Show you the quickest and smartest way, healthiest way for you to overcome the low thyroid. But I know all of you are not just low thyroid. So this applies to anyone with any thyroid condition or what you think is a thyroid condition that you may need help with. And surprisingly, it's not usually a primary thyroid problem. So we'll get into all of that. I'll explain why thyroid diets and just are a waste of time and what to do instead. I'll explain really how to move beyond the lab numbers, okay? Because you also need actionable steps and, I say tips and tricks, but you have to do the right things consistently to be able to move the needle. And you need to know what to do for you. And so you'll learn how to develop a customized plan, right, to help you overcome these problems. Get your energy back. Stop being depressed or anxious. Stop the mood swings. Husbands would like that too, right? It's all about helping you to reverse the symptoms that you have, no matter what the cause is. Could the cause be thyroid issues? Absolutely. Could it be other things? Many other things are possible. We're going to go through all of those. So can't wait to share this information with you again during the 3-day Fix Your Thyroid Masterclass. All right. And to register, be sure to register so you get all the reminders and everything. That link will be, my staff, my helpers tonight will be putting that link in the comments for you to register for the masterclass. And share with your lady friends, those you know that they're searching for answers too, or maybe they're just tired of being tired and they don't know what to do. Well, share this with them, help them become part of the group, because it is an amazing group and you guys are awesome. And I see so much of you, so much of the support that you give each other, so much of the just the appreciation for the information. I personally appreciate that you are so appreciative of the information that I try to share with you that really can unlock the uh, the you know unlock your struggles with your health and with these thyroid issues. So get you unstuck. So I'm that's fun. It's really fun. So let's dive into tonight's topic. Big topic, you guys. Let me get back to see if I can get my comments. Okay. Um, who here? How many of you have heard of the new HRT guidelines? Just put a yes in the comments, or me. Yeah. Thank you, Margaret. Hi, Margaret. Hi, Bridget. Um, yeah, there's a lot of talk, and I want to talk with you today about, you know, of course, this has created a tremendous amount of confusion, this whole HRT issue among doctors and patients for over the last 20 plus years. So, this hormone replacement therapy, or HRT, okay, causing all this stir. And because depending on who you listen to, you may hear one of two completely different messages about this. So for years, women were basically told that hormones are dangerous, that estrogen causes breast cancer, and hormones cause heart attacks and strokes. Essentially, you should just stay away from them unless you absolutely have to use them, right? Now, with the recent changes to FDA guidelines, we're starting to hear almost the opposite message now. Hormones are wonderful. Hormones are protective. Every woman needs hormones. If you're over 40, you should start taking estrogen. I mean, and I want to tell you right up front, I actually don't agree with either extreme, okay? Because neither one represents good individualized medicine. And that's really what I want you to understand today, okay? The new FDA guidelines are important. I do think they're a very positive development, but but they do not mean that every woman should be taking hormone replacement therapy. What they mean is that we can finally start having a much more balanced conversation about hormones. And instead of asking, are hormones good or are hormones bad? We need to start asking a much better question. Are hormones right for this particular woman? Are they right for you? Okay, so that's a completely different conversation. Now, I've done a Wellness Wednesday fairly recently on hormones, and I describe what they are. I'm not going to get into that too much tonight because there's a lot I need to share with you about this. So I'm not going to, define hormones or anything tonight. There's just a lot of information on that. I mean, maybe I need to do some sort of masterclass on hormones. I don't know. So let's talk about what actually changed with these guidelines. So let me give you a little background. I'm going to refer to some notes as well, just so I tell you the right information. I want to get you the right information. So look, back in the early 2000s, we had the Women's Health Initiative. Okay, and after those studies came out, hormone replacement therapy basically got it got hit with a giant red warning label. Women became terrified of estrogen. Doctors became terrified of prescribing estrogen. And hormone therapy use dropped significantly. All right. But here's something that's really important. Okay. The average woman in that study was around 63 years old. That's very different from a woman who's 48 or 50, 52 years old, who's just entered, menopause and is struggling with hot flashes, night sweats, insomnia, vaginal symptoms, and major changes in her quality of life, right? Those are not necessarily the same women. We should really, we should not assume that the risks are identical. Over the years, researchers began looking more closely at the data, all right? And the picture became much more, nuanced than what women were originally told. Um, so then in early 2025, the FDA formed an expert panel to take another look at menopause and hormone replacement therapy. And in November of 2025, the FDA announced that it was beginning the process of changing the boxed labels on menopause hormone products. Okay. Then in February 2026, the FDA approved the first updated product labels. Okay. Now, I want you to understand exactly what changed, because this is where social media can get a little carried away. The FDA requested that several warnings be removed specifically from the boxed warning. Okay. That included warnings related to cardiovascular disease, breast cancer, and probable dementia. The FDA also moved away from the blanket statement that hormones should always be used at the lowest possible dose for the shortest possible amount of time. Okay, and for women using systemic hormone therapy for significant menopausal symptoms, the FDA is emphasizing something we call the timing window. In general, that means looking very differently at a woman who is, say, 60 or under 60, or within about 10 years of menopause, compared with a woman who is starting hormones much later in life. So that's a really important distinction. All right, but here's what the FDA did not say. And this is probably one of the most important things I can tell you today. Removing something from a black box warning does not mean there is zero risk. Okay. The FDA did not come out and say estrogen can never contribute to breast cancer. They did not say hormone therapy can never increase cardiovascular disease. They also did not say there's no risk of blood clots. And they certainly did not say every woman should start taking hormones. That isn't what happened. Important risk information is still included in the prescribing information for these medications. And there are still women for whom hormone therapy may not be appropriate. So I don't want women going from being terrified of hormones and all of that to suddenly assuming hormones are harmless. Both of these positions are too simplistic, and medicine is rarely that simple. So instead of asking, is hormone replacement therapy safe? I want you to ask a better question. Is hormone replacement therapy appropriate for me? Well, you. Because those are two very different questions. Okay, I've been practicing functional medicine for a long time. And one of the things I've learned over and over again is that two women can walk into my office with almost identical symptoms and have completely different things going on underneath the surface. Let's say that I have two women who are both 52. They're both in menopause. Let's see, they're both tired. They're both having hot flashes. They're both gaining weight around the middle. And they both have hypothyroidism from Hashimoto's. And it would be very easy to say, well, you're both menopausal. Let's give you both hormones. But one woman may be a great candidate for hormone replacement therapy, and the other may have risk factors that completely change the conversation. That's why I like to think about hormone therapy this way. The right woman, the right reason, the right route, the right hormone first, the right route, and the right timing, including after her root causes were properly addressed. Okay, let me walk you through that. So the right woman means, okay, first, who is the woman sitting in front of me? Okay, what is her personal medical history? What is her family history telling us? Has she had breast cancer or endometrial cancer? What about unexplained vaginal bleeding or a blood clotting problem or stroke? Has she had significant cardiovascular disease or liver disease? What medications is she taking, right? And certainly, the What does her metabolic health look like? What is her blood pressure? What does her glucose and insulin look like? And all of these things matter. This is not something I want to decide based on one hormone level. It should be that obvious, right? It should be obvious we don't want to base the decision on one hormone level. And it's certainly not something I want somebody deciding because her girlfriend told her she feels amazing on estrogen. Look, we need to look at the whole woman. Okay, so next thing is the right reason. The next question is, what are we actually trying to accomplish? Is she having debilitating hot flashes or night sweats? Is she waking up 3 or 4 times every night, right? Is she having vaginal dryness, painful intercourse? Or is she having recurring urinary symptoms? Are we concerned about bone loss for this woman? What's actually happening, right? Because hormone therapy is a treatment. And just like every other treatment I use, I want to know what is the problem I'm trying to solve. I don't want to prescribe hormones simply because somebody turned 50. All right. The next thing is the right hormones. And then we have to look at what we're giving, right? For example, does she still have a uterus? Because if a woman has a uterus still and we're giving systemic estrogen, we generally have to think about protecting the lining of the uterus with progesterone. Okay, so those must be balanced, right? Because estrogen can stimulate the endometrium, and giving estrogen alone to a woman with an intact uterus can increase her risk of endometrial cancer. So again, this isn't just here's some estrogen, have a nice day. Right? There are important clinical decisions that have to be made. Okay, and then we have to talk about the right route and how we're going to give these hormones. Because oral estrogen and the patch transdermal estrogen are not necessarily the same thing. Transdermal means we're giving estrogen through the skin, usually through, like I said, a patch or maybe gel or a spray. And there is evidence suggesting that the risk of blood clots may be lower with transdermal estrogen than with oral estrogen. So route matters, right? And then there's vaginal estrogen. That's another completely different conversation, right? If a woman's main problem is vaginal dryness or painful intercourse or genital urinary symptoms common with menopause, recurring UTIs, things like this, local vaginal estrogen produces, much lower systemic exposure, or absorption than taking systemic estrogen. So when somebody says something like, estrogen's safe or estrogen's dangerous, my response is going to be, well, which estrogen are you talking about? What dose are you, what's the route, for which woman? Okay, that's actually what matters. Okay, then there's the timing, which is huge. Starting hormone therapy in a healthy 50-year-old woman who recently entered menopause is not the same situation as starting systemic hormones for the first time in a 68-year-old woman who has been menopausal for 15 years. Ladies, those are two very different clinical scenarios. And this one is one of the most important concepts behind the newer FDA labeling changes. In general, hormone therapy appears most beneficial when it's started in appropriately selected women under the age of 60 or within 10 years of menopause. Does that mean a woman over 60 can never take hormones? No. Again, this is individualized medicine, but the conversation changes. All right, now finally, were all the root causes of the symptoms considered? Right? Was it for sure a hormone issue? Was thyroid metabolism balanced? And this is something I really want any of my female patients to understand, because if you have Hashimoto's or hypothyroidism, things get even more interesting. Look at the symptoms we commonly associate with menopause. So fatigue, brain fog, weight gain, hair loss, anxiety, depression, poor sleep, right? Mood swings, changes in bowel function, gosh, temperature changes. Okay, and then of course, uh, changes in menstrual cycles. So while you're in perimenopause, right? Well, doesn't that list sound an awful lot like low thyroid or thyroid dysfunction? And this is one of the problems I see all the time. A woman hits her 40s or early 50s, she starts gaining weight, she's exhausted, brain isn't working well, she can't sleep, and her hair's falling out. Of course, she's anxious. Somebody says, well, you're in menopause. Okay, maybe menopause is contributing, but that doesn't automatically mean menopause is the entire problem. In fact, menopause isn't a disease, all right? Menopause symptoms typically are caused by thyroid dysfunction, low thyroid especially, all right? And which leads to a lot of times adrenal dysfunction. And so you're going to get these menopause symptoms, especially if she also has Hashimoto's, okay? And I get into that a lot in the masterclass. This is so important because everything is so interconnected. And again, hear me when I say menopause is not a disease, right? So before I assume estrogen is going to solve everything, I want to know what her thyroid is doing. It has to be balanced first. And I want to know that her metabolic health is okay. And I want to know, what her insulin is doing, which contributes to that metabolic health. And I want to know what her stress physiology looks like. What's her cortisol doing? How are her adrenals looking? I want to know what else is contributing to these symptoms. Okay, because if you don't look at those things, you can miss all of the important upstream issues and causes, right? This is why comprehensive testing is vital. You have to know what the problem is to solve it, and you have to know what the problems are before just assuming this is a hormone issue. And estrogen can also affect thyroid hormone function. There's something women with hypothyroidism really need to know. Estrogen can actually affect thyroid hormone function at the cellular level. And this is particularly important with oral estrogen. Oral estrogen can increase something called thyroid binding globulin. And when thyroid binding globulin changes, it can affect how much thyroid hormone is available in circulation. That means a woman who has been perfectly stable on her levothyroxine or Synthroid may start oral estrogen, and suddenly her thyroid medication dose may no longer be appropriate. And really, it's because it's changed the way, the thyroid works in the cells. So her TSH and other thyroid markers can change as well, or they may not, but her thyroid hormone requirements, change when it starts to interfere with thyroid hormone function. So if you're taking thyroid hormone and you begin or discontinue estrogen therapy, your thyroid labs may need to be reevaluated after your body has had time to adjust. Again, individualized medicine is the key. Every system and organ affects one another. And let me give you 3 women as examples, because I think it becomes much easier to understand when you put real people around it, right? Like, let's take Trish. All right, she's 49 years old. She's in perimenopause. She's having terrible hot flashes and night sweats. She's barely sleeping, right? Her quality of life has gone really gone downhill. She has no history of blood clots, no breast cancer history, okay, no cardiovascular disease, maybe risk factors, but no cardiovascular disease. We get her Hashimoto's into remission, lower her cardiovascular risk, right, and her thyroid balanced. That woman may be an excellent candidate for the proper then urine or saliva hormone testing and a conversation about hormone replacement therapy, okay? So for her, the potential benefits may significantly outweigh the risks. Okay, let's take Marcia. She's 58, 7 years into menopause, all right? She's still symptomatic with hot flashes, night sweats, and mood swings. But she also has obesity, insulin resistance, right? Her blood pressure is high, and she has a strong family history of cardiovascular disease. Does that automatically mean she can never use hormones? No, it doesn't. But am I going to have the exact same conversation with her that I had with Trish? Okay, absolutely not. I'm going to look much more closely at cardiovascular and clotting risk markers, right? I may think differently about the route of administration. I may want additional testing. I'm going to individualize that decision, right? All right, now let's look at Wendy. She's 67 years old, 15 years past menopause. Okay. She isn't really having significant menopausal symptoms, but she is, watching videos online saying that every woman needs estrogen to prevent Alzheimer's disease and heart disease and to live longer. Okay. So now she wants to start hormones. That's a completely different conversation. And I'm not going to take that decision I made for that healthy 49-year-old, right? Or, and simply apply it to this 67-year-old woman. That's not individualized medicine. All right, so this is where I think social media gets us into a lot of trouble. We're living in this world of sound bites. Let's see. So we hear estrogen is dangerous. And then we also hear estrogen prevents Alzheimer's now. Let's see. We hear every woman over 40 needs testosterone. We hear progesterone fixes sleep. Or how about everyone should be on bioidentical hormones? Ladies, human physiology is more complicated than that. I wish it were that simple, but it just isn't. Your body does not care what is trending on Instagram this week. And your hormone treatment should not be based on a TikTok algorithm, right? It should be based on you. All right, so what do you think about the new FDA changes? Okay, what do I think about the new FDA changes? Overall, I think they're a good thing. I think we needed to correct a fear that came out of the Women's Health Initiative. And many doctors, really needed to calm down about that, right? I think many women who could have benefited enormously from appropriate hormone therapy were scared away from it, okay? And because so many doctors became so concerned about prescribing it that the conversation simply stopped, right? So I think bringing individual considerations back into the discussion is absolutely appropriate. But here's the sentence I want you to remember. Okay, the FDA removed a one-size-fits-all warning that does not justify one-size-fits-all prescriptions. Okay, those are two very different things. Hormone replacement therapy is not something every woman should be afraid of. And it's also not something every woman automatically needs. It is a therapeutic tool. And when we use any therapeutic tool, we want to use it appropriately for the right woman and for the right reason, at the right time, right? After upstream issues are cleared, using the right hormones, right? Through the right route at the appropriate dose. And then we monitor, we evaluate, because you change and your health changes, your thyroid changes, okay? Your metabolic health changes, and your risks change, right? Goals change. So the conversation may change over time as well. And ultimately, your age doesn't tell me anything about whether you need hormones. Your estradiol level alone doesn't tell me whether you need hormones. Your friend's experience with hormones doesn't tell me whether you need hormones. I think you get the picture, right? Social media, doesn't tell me that you need hormones. So you just have to look at your symptoms, your medical history, all of the information, your thyroid, your metabolic health, right? And all those risk factors, cardiovascular, cancer, bone health. We look at your goals and your quality of life. So get comprehensive testing and a comprehensive analysis of that testing. And then we put all those pieces together, because that is what individualized medicine is supposed to look like. Customized care. All right, so the one thing I want you to take away from tonight is this. The new FDA changes don't mean every woman needs hormone replacement. They mean every woman deserves an individualized conversation about whether hormone therapy is right for her. Okay? All right. I have time for just a couple of questions. And then we'll wrap up, okay? So if you do have any questions, put those in the comments. And, you know, I'll just say a word or two about the masterclass. Again, super excited for that. Uh, I take it's so valuable to understand that you need information to figure out your problem. Because if you know you have symptoms, jumping from the symptoms to the fix skips all that's in between. And I explain what my thyroid repair system is in detail, go through all the appropriate, necessary steps of that system that you need to, employ in your journey back to health to fix your thyroid and change your life. So it's, I go through that system. I show you how it works. I show you the testing, show you, how I go through the testing evaluation. And that way you know exactly what you need to know so that you can start to reverse your symptoms. Okay? It's very, very important that you have the right information for yourself and the right system, all right, that gives you the tools, okay, the knowledge, the tools to set you up for success. All right. So let's see. Let's get to Vicky's question here. I want to protect my brain, breasts, and bones. I'm assuming when you refer to estrogen that you're referring to bioidentical estrogen. I actually am. Again, research has shown that bioidentical estrogen is definitely safer, and but again, it depends on the route and all these other risk factors. On if you have risk factors, if you have certain history, that has to be part of your conversation, right? Okay, Leah says, I need help. I'm drowning. My health is at its worst. Yeah, I'm so sorry to hear that, Leah. But I will tell you, you need to make attending the masterclass a priority. And any one of you women who are feeling like Leah, look, I explain why one lab test is never going to get you there with checking your thyroid, okay? It's never going to get you there. It's so important that one second. It's so important that you figure out what the problems actually are so that you can actually address them. And usually it's multiple problems. If you have a lot of symptoms, that's your body's way of letting you know that something isn't right. And you really do need to know what's going on specifically. And only by, getting the testing that you need is going to get you that information. So attend the masterclass. Like I said, I'll go step by step through my thyroid repair system that will help you get this information about your body. There's a lot of reasons why you're still stuck. I'll share the biggest ones with you. There's, I'll help you determine exactly what, thyroid supplements are helpful, not helpful. We'll give you so many actionable steps that you can start to implement right away. Okay. So you really do need to attend. Register and attend. Don't make it one of those things where you register and then forget about it. Register and put it on your calendar. Okay. The 31st through the 2nd, 3 nights, 3 evenings, right? We go live same time tonight as tonight at 6 p.m. Pacific, 7 Mountain, 8 Central, 9 Eastern. And I'll see you there. Let's see. Charlene asks, maybe I need my something removed. You didn't say what removed, but doctors haven't said anything like that. I'm going to ask on my next visit. Don't know which organ you're talking about, but if you're talking about thyroid, you definitely need to figure out what it is first that's going on with it. If you're talking about getting a hysterectomy or whatever, Again, you need to get the proper testing. Okay, Tina says, does Dr. Ed work with someone that has H. pylori? Absolutely. In fact, we find H. pylori a lot, a lot. And so that is a lot of times one of the hidden root causes and infections that people have when they're dealing with autoimmunity and, like Hashimoto's. Yeah, that's definitely a common thing we find. And Liz asks, so how do I know if I need to get off thyroid meds? Well, you do need to attend the class. I mean, bottom line, so that you know what would be right there or not. And so knowing what the right testing will show you will give you better information so that you can make that judgment and you can and have help to make that judgment call. Okay. I don't recommend just getting off your thyroid medicine. That's not something I'm recommending, not without any other information. But it is sometimes something that is recommended. Let's see. Rory, hi Rory, asks, should you have your thyroid reevaluated after you've been through a program? Yes. I mean, to discuss hormone therapy, yes. That's definitely part of the proper testing to get comprehensive testing again. You don't have to redo the genetic panel, but you would need to redo the rest of the comprehensive testing and hormone testing too, either saliva or urine testing. And Lori asks, what would you recommend for a 27-year-old who had a complete hysterectomy a few months ago for ovarian cancer? My goodness, right? That's awful. And the cancer was estrogen driven. So she is now suffering massive hot flashes. So a lot of times, estrogen dominance there causes those kinds of cancers when you don't have enough progesterone. And why don't you have enough progesterone? Because when you're stressed, your adrenals produce too much cortisol, and that deprives you of the building blocks to make progesterone. Okay, so then you don't make enough progesterone to balance the estrogen, and the estrogen has its heyday, and it causes you to build up the endometrial lining. And so doctors don't know why you produce less progesterone. They don't even check for why you have cancer. It's ridiculous. They don't even check for why this happened. They just say, okay, well, we need to take it out. So they do. And then you're stuck with probably needing, I'm not saying you do, but probably needing some kind of hormone replacement therapy for the rest of your life because you need hormones. And if your adrenals are already, suffering so much, that's probably what what you're going to need. But I can't say that. You can't go home and tonight and say, Dr. Ed says I need, hormones, but you've got to get the right answers and you've got to get the right tests. So for you, I would also recommend attending the masterclass, finding out how to get this information, what to do with this information, and fix this, especially if you're having symptoms still. All right, Denise says, for me, not sure if all the symptoms I have are attributed to thyroid or to Lyme, which I thought was in remission. It's a good question. And so again, testing should be very helpful, and how you're progressing if you are in treatment, it's the retesting is going to be important, right? The follow-up testing, and just see which symptoms are improving, which are not, and then you may need treatment for, the Lyme that may not be in remission. Okay. Let's see. Ray asks, hi, do you treat people with PCOS? Absolutely. Yeah, polycystic ovarian syndrome. And it's driven by insulin resistance. And that causes higher testosterone levels. So definitely need to find out your underlying root causes. Definitely attend the masterclass. This is definitely for you. So again, it's the 31st, August 31st, September 1st, September 2nd. Okay? Those three evenings. At 6 p.m. Pacific, 7 Mountain, 8 Central, 9 Eastern. And we go for about an hour and a half. If you can't, catch all the sessions, we do keep them replaying through the rest of the week, but really stress the importance of attending live. It's very, very important to attend live so that you can get all the information firsthand and get support from the group and the staff who is there to answer questions and everything. So it's very important to attend live. And Pamela asks, can you please explain the connection between thyroid and low ferritin, but no anemia is present? So I do go over this in the master class when I do case studies. And just in a nutshell tonight, I will say that, so low ferritin means low iron storage. And that way, that means that you can't release enough iron into your system for your cells to actually make TSH. Sometimes that affects your ability to make TSH from the pituitary. You also need iron to convert T4 to T3. So if you're missing iron and you can't, convert T4 to T3, that's going to affect thyroid health. And you may not have anemia because it may not be affecting your red blood cells and your hematocrit and your hemoglobin, right? That's how they diagnose anemia, but it could be still causing these problems, cause low energy, fatigue, Yeah. So we just know how to put it together, right? And you'll need more information than that. A lot more information about what's going on with all the different organs and systems with the comprehensive testing that you'll learn about in the masterclass. Okay, are there any other questions? I'd probably wrap it up there. And if you do have any others, does PCOS change? Anna asks, does PCOS change after total hysterectomy? Sort of, but that doesn't fix the problem. It doesn't fix the cause of it. All right. You may see changes, but it doesn't fix the problem. Okay. I'm seeing there may be one more. Maybe. So put the master class on your calendars, ladies. And yeah, we're gonna talk about a lot during the master class. We're gonna talk about top 5 reasons why can't lose weight, so many other things. All right. Ladies, I think I'm gonna leave it there. This is an important topic we covered tonight with this hormone replacement therapy, HRT, okay? And what kind of conversation we need to have about it. Okay, last question. How does fasting affect low thyroid? It really depends on what else is going on. If you have blood sugar dysfunction with that low thyroid, fasting will be the worst thing you should do, okay? If you have hyperglycemia most of the time with no variability with your blood sugars, then fasting may be okay. But I'll tell you, most of the time with thyroid dysfunction, fasting is not helpful, okay? You're already dealing with low metabolism and fasting does not help low metabolism, okay? So there you have it, ladies. Have a great evening. Thanks for attending this Wellness Wednesday and hope to see you all at the masterclass. Have a great night.